All right. It's a pleasure to introduce Dinky Thakkar. Ms. Thakkar is a program director working on Health Data Platform BC with the Ministry of Health. I've had the pleasure of having guest lectures from her team in my undergraduate classes this past year. She completed her master's in electrical engineering from New York City or New York University and has over 12 years of experience building product services in different industries within the US and Canada. She has experience in leading and strategizing product builds backed by multiple data collaborators. Dinky joined the Ministry and Health Data Platform earlier this year and is primarily focused on user experience, scalability, and platform enhancement. Please welcome Dinky Thakkar.
Thank you, Dylan, for the introduction. And hey, good morning, everyone. Let's see. There we go. I'm waiting for. Yeah, okay, perfect. That's in presentation mode. One step for. Okay, let's see. All right. First and foremost, I would like to start with acknowledging that we are gathered on the unceded traditional and ancestral lands of First Nations in this place known as British Columbia, where we work, play, and live. And today, I'm speaking from the 1515 Blanchard building that sits on the land of the Lekwungen-speaking people and neighboring nations of Esquimalt, Songhees, and Saanich. With that, we are going to be spending the next about 40-ish minutes talking about Health Data Platform BC, or commonly referred to as HDP BC. As for the agenda, we are going to start with what is HDP BC, very basic, right? What are we all about? Followed by who do we support? We'll then dive into what data sets are available and how to access the platform, and then leave some room towards the end to open up the floor and for Q&A to answer any questions you all might have today. So this is your third session for the day. Before we dive into the health data platform and agenda items, I wanted to start with a rather simple question that I would like to ask all of you. And the question is, what retail platform or shopping app comes to mind when you think of online shopping? I'll give you guys 30 seconds to respond, and I'll tell you what my response would be or what my answer would be. And its name it's a name of a rainforest. It's not a kind of, and it has a sale going on right now that I'm not supposed to check out. Let's see. Let me try and see if I can get to a meeting chat. Okay. That was easy to figure out. Yes, Amazon. Right? And the reason I wanted to kind of open with that today, right, is one thing that's common for a lot of these platforms, whether you're thinking Amazon or Etsy or a few other ones that are out there, all of these offer aggregation of a variety of products in one place and services to utilize these platforms, to shop for this multitude of products. And I feel like that's a good analogy for Health Data Platform. Health Data Platform BC provides platform and services that enable secure cloud-based data research and analysis. We launched a minimal viable product solution sometime back in July 2020. And then since then, we have been iterating on various enhancements to the platform to further add additional capabilities and features that support this secure cloud-based solution. A few highlights to include are one of the things that it offers today is a personalized remote desktop environment, a remote desktop that offers a personalized experience with user-specific applications, contents, settings. It also provides both personal as well as shared storage drives that then helps you increase efficiency and helps you with collaboration across different team members that you have working on the project in a secure fashion. This is a secure remote desktop. What that means is internet is not accessible when you are within the desktop. But think of it, it's actually a VDI machine. So it's a desktop that you can
Oh, I think we lost.
Can you guys hear me?
Yep, we can hear you.
All right. Looks like it just kicked me out. Sorry about that.
Yeah, you're mentioning securable desktop.
Perfect. Thank you, Dylan. Yeah, so while internet is not accessible from within the desktop because the desktop is secure, there are quite a bit of other tools that are that are often not available within the desktop when you are accessing in a secure fashion. There are tools like GitLab, for instance, that provides extensive training documents that outline how-to videos about the desktop. There are code examples and queries for various data sets and views that you can leverage and use for your research and analysis purposes. The next thing is access to health sector data sets and their metadata. We currently provide a unified access to provincial data collected through our partnerships with variety of various health authorities going back to an average of, I want to say, about 10 to 12 years, depending on the data set. In addition to that, these data sets are refreshed on a regular basis. Sometimes it's monthly, some of them are quarterly. Again, right, it depends on the data set and the type of data. So it's entirely dependent on that. And the benefit of that is that depending on your use case and your research, you could use that data set up to a predefined point in time, or you can also leverage the refreshed data as it becomes available. And the best part, without having to go through the whole access and approval process again for that refreshed data set. I'll hit on other features as well as more about data sets in the upcoming slides here in a few minutes, so I can keep us moving here on this slide. The third feature to highlight is the learning tools that we offer to examine and analyze data and manage analysis codes. We currently offer R, Python, and SAS for statistical analysis. And then we have SQL for any data wrangling or data preparation that you might want to do for your analysis. In addition to this, there are also some SQL code examples and how to documentation that's available again within GitLab in shared GitLab folders that you can leverage if you are new to Health Data Platform or new to a particular data set. These code examples and all the documentation is again regularly updated and enhanced by our health data platform teams so that we can continuously provide support and training materials throughout the project lifecycle. As all of you guys might be familiar, a lot of these projects do span over a couple of years, if not more. And then lastly, human reviews of any output leaving the secure desktop. Managing sensitive data in a secure fashion is one of the key values for Health Data Platform VC. This applies to the data that you bring in to the secure desktop as well as any information that you take out of the desktop. However, just because there's an additional step doesn't mean it can't be made easy, right? So we do have a self-serve tool within the desktop that you can use where you can submit a request to export any statistical products such as scripts or metadata that you would like to export onto the desktop. What that does is once that request gets submitted, it automatically gets routed to the team that supports these reviews and who then complete this in a very swift and a timely manner. The SLAs for turnaround time for these are pretty good at this point, and we make sure that we complete these reviews, ensuring data security and integrity. And once they are approved, you get access to a different tool which is outside of your desktop, since the desktop it sits behind a firewall, quote unquote, where you can download all the relevant information that you wanted to take out. Now that we covered what is Health Data Platform, let's go to the next slide. Yeah, I think I lost control, and that's okay. If you can just move us to the next slide. we are going to focus on who does HDPBC support. Currently, Health Data Platform BC supports all types of health-related research, but very broadly, they can be categorized kind of in two types, right? Based on who is sponsoring the research project. There is the organizational research path. This is research that's sponsored and led by a public sector health organization like Ministry of Health or any of the other health authorities. What this means is you can be an academic researcher who's affiliated to an academic institution, but are also an employee or a contracted service provider to one of the BC health authorities or BC Ministry of Health. You could fall into these route where you could submit a request for data access. Before you do that, you would be able to contact your health authority. There is a point of contact that we have available. There is all this information is available on the website. There is a list of point of contacts that you can contact and make sure that you fit the organizational route. And if your project meets the criteria for an organizationally sponsored project, they can help you determine that and also help you secure an approval from the health authority's organizational designate, which then in turn you can use to submit your data access request. The other path is academic research that may not be sponsored or led by a public sector organization. These are requests that are sponsored and led by the academic institutions. We currently support academic research requests in partnership with PubData BC. And Gita just walked all of us through quite a bit of information, and there is a PubData BC website that you can learn more about their process as well. I'm sure at least few, if not most of you who attended the presentation topic that Gita led with PubData BC and now hearing about Health Data Platform BC are thinking, so what's the difference between the two, right? Which one do I go to for my research project needs? So the answer to that question depends on who is sponsoring and leading the research project. If your research project fits the definition of an organization research that is being sponsored and led by a public sector organization or Ministry of Health, you can reach out to Health Data Platform. If your research fits the definition of an academic request, you can reach out to PubData BC and they will further help and support and guide you through the process and the project lifecycle. Like everything else in life, there are always edge cases or nuanced scenarios. If you're still not sure which path the request would follow, you can always reach out to either the PubData team or the HDP front counter team via email. I'll share the detail for the HDP front counter team email here at the end of the presentation. And either one of them can help you determine which of the two paths your particular project request fits, and then guide you through the next steps for data access for research and analysis. All right, if we go to the next slide, I talked about PubData BC and Health Data Platform's partnership with them to support academic research. However, in addition to PubData BC, Health Data Platform also has partnerships with other health authorities, CIHR, which is the Canadian Institutes of Health Research, and Health Research BC. All the work in relation to Health Data Platform BC and I got kicked out again, didn't I?
Yeah, you just all the platforms on Health Data BC, that's where it stops.
Yep, that's all right. Thank you, Dylan. This is the fun part of doing this virtually and not in person. All right, so what I was talking about was all the work for Health Data Platform BC is currently being led and developed by Ministry of Health. We have matching funding from CIHR through their National Strategy for Patient-Oriented Research, the BC Support Unit, and the province of BC. And all the solutions that we are currently building and delivering are in collaboration with Swansea University. Since our launch back in July 2020, We have right now I want to say about 22 active organizational research projects that are using the Health Data Platform VC's cloud-based solution for research and analysis. To give you guys some of the examples, right, of what type of projects are currently actively currently actively using Health Data Platform. We have one project called Outcome Evaluation of HealthLink BC, Emergency Eye Doctor and Assisted Program. That's a long name, short for HIDE. HIDE program currently is designed, the evaluation is focused on to determine does the use of virtual physicians in partnership with nurses triaging 811 callers lead to reduction in avoidable emergency department or urgent primary care clinic referrals? Does it does it lead to an increase in accelerated referrals of callers to the emergency department, and a few other potential outcomes? We have another project that's focused on learning about opioid use disorder in primary care. The purpose of this project is to obtain data on medication and care for people with opioid use disorder over time, and then to further inform and assess the impact of a provincial improvement initiative. The provincial initiative aims to improve access and uptake and retention in the opioid agonist therapy by increasing the capacity of primary care providers. So this project is focused on analyzing the data to identify if there are any gaps in the therapy access and utilization, to monitor the progress of the initiative, and kind of further inform the initiative and the subsequent health outcomes. We have Health Data Platform BC website that further outlines all the current active projects that we have. It gives you a little bit of a brief description which outlines what the goal of each project is or what the objective is. And we also have some additional statistics around what are the number of projects that are actively working on preparing for the data access via Health Data Platform. So all those wonderful insights are available on the website if you're interested to check out. Let's go to the next slide. So we covered the what, we covered the who. Now let's dive into the why. Why use Health Data Platform BC for your research and analysis? And while there are a multitude of reasons and benefits to using the platform, I'll focus today on three core benefits: security, data centricity, and simplicity. Security, right? All the design principles, operations, and approvals currently for Health Data Platform are guided by the internationally recognized 5 SAFEs framework. What do we mean by 5 SAFEs framework, right? 5 SAFEs framework pretty much has 5 criteria, as the name suggests. So each incoming data access request that we receive for Health Data Platform is assessed according to that criteria. The 5 criteria are safe people, meaning only authorized individuals who are approved, who are trained, and who have completed a privacy training can access the data. The next, safe projects. The projects go through an approval process to ensure that the data projects have a public benefit and pose no harm to individuals or communities. Safe data. Data is de-identified to support any research that can still lead to powerful analytical insights, all while maintaining individual privacy and confidentiality. Safe settings. Using the right technology in a secure and a compliance monitored environment to integrate data safely. And finally, safe outputs. We have human reviews for additional protection of privacy for any type of output that leaves the secure environment. Data centric, as I mentioned earlier, Health Data Platform provides access to a multitude of provisional data sets. I'll go into a little bit of detail here in a bit. To both data sets and cohorts from all health authorities. And these data sets are refreshed on a regular basis as well as provide statistical analysis tools and services. Again, I touched on this on the prior slide a little bit about our Python, SAS, and SQL to facilitate the efficient research, collaboration, and sharing. And lastly, simple. Let's say you have a project that requires access to, I don't know, data set A that comes from PHSA. You need access to data set B. That one comes from, I don't know, Fraser Health. Now, instead of working with these individual health authorities, going through the application process and the approval process individually for each of these data sets, what Health Data Platform would provide is a single multi-organizational application process that enables that access request to data sets and cohorts across all health authorities, and a streamlined approval process across all organizations. So those are some of the benefits that I wanted to touch today about why. Now, if we go to the next slide, that I have all that information overload about Health Data Platform and the what and the why and the who. Let's dive into the topic that is core to any research and analysis, right? Data, the heart to it all. Health Data Platform BC currently provides access to about 19 data sets, and this includes reference and population data sets. I'll not go through each and every data set. The list is on your screens on the left-hand side. However, I did want to call out, or I did want to kind of call out two things about the data sets. First, there are data sets such as reference data or population data that are available to you by default as part of your project request. So anytime you submit an access request, these are the data sets that we make available to you as we have, without you having to go through any justification or explanation of why you need these data sets. And second, for each of the data set, if you look at the image on the left, you'll see there are kind of two check boxes next to each data set. One which reads, one column that reads available with data set, and then the other one that reads additional approval required. What does this mean, right? For each data set, there are a variety of variables that are already pre-approved and made available when you access a particular data set. This is important because if your project is using any of the variables that are already pre-approved, this is where we work with all the health authorities as we provision these data sets to confirm that they are comfortable releasing a certain set of variables, rows and columns, and consider them pre-approved. This will help expedite the request adjudication and approval. However,
Oh, back now. Apologize for this.
this is
You said
fun.
pre-approved, however. That's
I guess I should start quizzing people on the call, Dylan, instead of you telling me where I left off, and we can
I
see.
apologize. Yeah, I'm not too sure what's going on with this.
That's all right. No worries at all. It happens. I guess I still have, at the time I have, I might be kicked out 2 more times, guys. So bear with me here. All right, so what I was referring to was the list of pre-approved variables that we have that come along with each data set, and why that is important, because like the name says, it's already available with the data set, it's pre-approved, and hence it expedites the request adjudication and approval to get you the data in a faster fashion. However, the data sets are not limited to just these variables. If you wanted to have access to any additional variables that are not pre-approved, quote unquote, you could request access to these additional variables and provide an explanation as to why would you want to use these variables. That then goes through the adjudication process to the council and gets your request approved. Again, all the information about what the variables are, what type of data, which variables within a particular data set are pre-approved and which ones are not. All of this information is available on the Health Data Platform BC website. I'm not going to pull up the website today, but you guys are more than welcome to browse through any of those. In addition to the 19 data sets that we have, and the two that we recently added, which is Cancer Registry and the V2P Clinical Data Center, we are actively working with health authorities to get more data sets into the platform. And in pursuit of that, we have three other data sets, namely the Provincial Immunization Registry, cardiac and long COVID clinic data sets that are actively being worked on by the team for quality checks and provisioning and all the magic that happens under the proverbial hood of the car, which right now is the desktop, in the upcoming months to make those data sets available. If you go to the next slide, there were a few other key callouts regarding the data that I wanted to make today. There are data shopping tools and mapping tools that are available both inside the secure desktop. So when you are working inside the desktop, you have these tools available, whether you want to refer back to the metadata and or look at the mapping of those data. We have tools inside the desktop as well as outside on the Health Data Platform BC website that outlines all the relevant information about the data. Again, right, like what's my variable name? What are the different types? When was the data last refreshed? What is a brief description about the variable so you can understand more about what that variable is and or what the format of that variable should be. And even whether that variable is pre-approved or not. It also includes other relevant information about data, like are there any quality issues? Are there any data limitations that you should be taking into account that would further inform your research and analysis? So all of this information is available, like I said, both inside as well as outside of the desktop, of the secure desktop, for you to access. All the data is de-identified and linkable using keys like PHNs. One of the other key capabilities that I do want to call out in addition to the data that we offer within the desktop is the capability to bring your own data. We have encryption and ensuring de-identification that's applied to both the data that we offer as well as the data that you bring in. To expand a little bit more on the bring your own data feature, today we support a variety of import capabilities and methods depending on what kind of information that you want to bring in into the secure environment to support the research and analysis. You could have survey data, or you could have another cohort data that you have that you would like to use as part of your research. So the three different mechanisms that we have right now is if you have a small file, you have a survey file, under a particular file size, let's say 24 MB or shorter or smaller, there's a self-service tool that you can leverage to upload the files securely. This is all again available both inside and outside the desktop. You can upload it from outside the desktop, and then once you upload these files using that self-serve tool, it sends a notification to the team member on the Health Data Platform team. And once they are notified, they go ahead, review your data and request, make sure all the compliance and security implications are addressed, and then ultimately they approve the file to be imported within the desktop. Once they approve, same thing, you get notified that, hey, your file is ready and available for all your team members. It's basically linked within your project. So it's again, not every team member have to upload their own file. You upload it once and done, and then it available for all your team members within the project to start using for your research and analysis. But small files, while important, sometimes cannot hold as much data that you would need for your research, right? So we also have another option where you can import large files or cohort data via SFTP transfers, which is basically secure file transfers. We have a front counter team and a technical team that will help you throughout the entire process, like providing you with a checklist and instructions on how to prepare your data for import. What are some of the requirements to make sure that you are securely transferring the data or securely transferring the data within the desktop. And then finally, the technical team will make sure, very similar to your small file, that the large file or your cohort data is available inside the secure desktop. Again, it's part of your project. all the team members within the project now have access to that data that you can now use to link with the other available data sets to perform your research and analysis. And while the data is key for research and analysis, teams often have code repositories, right, that they could use or benefit for their data analysis. So since the data kind right now sits behind a firewall in a secure desktop, that means it blocks the internet, right? You can't really access anything outside of that secure desktop. So we also offer a service today to securely import any GitLab code repositories that you may have or you may want to use for data wrangling or analysis or data preparation. Again, very similar to your large file. This one is not, again, a self-service tool, but we have a team of front counter comprising of front counter team and a technical team where you can submit a request to those teams and they will guide you through each step of the process and make sure that we can bring in all those code repositories inside the desktop to enable those to be used for research. So that was 3 different ways where you can bring your own data. One final important aspect that I did want to highlight for all of you today is ability to build your own project cuts of data. What does that mean, right? What that means is as part of the request, you indicate, hey, this is the data set that I want. Also, these are the variables. Do I want to use the pre-approved variables or are there any other variables that I'm interested in that I would also like to use for my research? Once you submit that request and once you are approved to have access to that data set we have available within the platform, what that means is you now have access to that data set and any other refreshes that you might make to that data set. And it's up to you to define and build your own project cut that supports the objective of the project. As these projects are lasting for a couple of years, if not more, you might run into, hey, there is this data set that I did include in my original request, but now I think it's relevant for the analysis that I'm doing. Or Health Data Platform added a new data set. As I mentioned earlier, we have a few different data sets that we are actively working on, which may not be available today, but could be in the next few months, which you feel is relevant for any of your analysis. You can always go ahead and while you are in the desktop and using it, you can submit an amendment request to get like a swift and a speedy access to that data. You're already in the desktop, you already have your project approved. So the amendment process should be simple enough to go ahead and enable these additional data sets, variables, new data sets, or whatever else that was not part of the original request, if need be, to continue your analysis. So that's all about data. And now that we have covered Health Data Platform PC and what it offers, if we go to the next slide, if you have a project that you would like to leverage Health Data Platform BC for research and statistical analysis, you can do so in a few easy steps, right? I'll keep it super high level. You prepare your data access request application. Both Health Data Platform BC website as well as Pop Data BC website have a lot of resources available that you can leverage to prepare the application in an accurate and thorough fashion, because that's going to ensure that the adjudication is speedy enough. Once complete, you submit the data access request and all the relevant details via Pop Data BC for adjudication. One of the other important things is to complete any privacy training if applicable. HDPBC offers a privacy training, but that doesn't mean you have to take those. If you have completed, let's say, Pop Data BC training, privacy training, or any other approved trainings, which are again listed in your application form, we do accept those. So that doesn't mean, so that's good, right? You don't have to do the privacy training multiple times. We accept those as completed privacy trainings and a prerequisite that you complete. Once we receive the request, it goes through the adjudication, and once the adjudication is complete, you get notified of the results. There might be sometimes conditions that you need to meet. And if they are applicable, we'll inform you about those conditions. Like I said, for example, privacy training. This is a prerequisite and you need to complete or provide proof that you have completed before we can provide you access to the data. So those could be some of the conditions. Once you meet the conditions and you are approved, you receive credentials either to the secure research environment that's supported by POP data or the personalized health data platform desktop that I have been talking about for past almost 30 minutes now, along with an onboarding package. This will outline all the relevant information. It will include how-to videos, along with all the requested data for you and your team to go ahead and get started on your project for research and analysis within whichever environment you get access to. And then from here on, you're set to access and conduct your research analysis within the environment or the desktop. You do have access to a dedicated front counter team that can help you troubleshoot any issues, support onboarding members, add or remove project members, submit any amendments. Like I said, if you change your mind about, hey, there is additional data set or variable that I like, you can go through the amendment process. And there is a team that could help you throughout the term of your project during your analysis and result phase, as well as all the way to the project closeout phase. And during your analysis, or rather between your analysis and project completion, if whenever you are ready with any publication materials or to complete the project, the team can also guide you through all the steps for any pre-publication reviews and approvals and or removing access to data and environment when you're ready to close the project. So that's a little bit about how to access data. If we go to the next slide, there is one other topic that I wanted to touch a little bit on today before I wrap up things here, and that's the Research Approval Process Project, short for RAP. I'm sure many of you on the call are familiar with the RAP initiative. If not, I'll do a very, very high level overview and tell you guys why I'm talking about it today. RAP is committed to strengthen a research positive culture within the health system in BC. Overall, the scope for the project kind of focuses on three primary areas: operational approvals, ethics reviews, and data access. Again, the objective for the initiative and the main focus is to reduce duplication, delays, and any ambiguity for researchers and health organization administrators alike. Right now, so far, the RAP team have begun to move forward with engaging subject matter experts to inform and validate the changes that they'll be making as part of this initiative. And there are, I believe, three streams of work that are underway. There is a research ethics review that's focused on developing a high-level ethics review policy and guidelines. There is an operational review, and then finally a privacy review to examine the scope and process of privacy reviews. So three work streams going on in parallel, again, to define and streamline and reduce duplication and increase transparency as well for researchers as you guys go through the process of requesting data access and or operational approvals. Why I'm talking about RAP today? Like I mentioned, there are three primary areas and for that are focused or that are in scope for RAP. One of them is data access. And data access stream is one of the primary areas where this work that they are conducting will be informed by Health Data Platform BC. We are working closely with RAP, and RAP supports Health Data Platform's approach to have a simplified, unified approval process for access to these data sets, whether they span multiple areas or a single area or a single organization for any data within the health sector. So we're working very closely with the project team as policy and guidelines are being defined overarching as part of this initiative. All right, that was the last topic that I wanted to cover for all of you this morning. If we go to the next slide, what is better than listening to me for 30 to 35 minutes talking about health data platform, Cliff Note versions of the same. So let's do a quick recap of all the different areas that I covered and we dove into this morning. So if you don't mind playing the video there.
Health data is collected and held securely by a variety of organizations across the health sector.
Is it just me or did it pause for everybody?
Yeah, it looks like it almost.
When you want to do research or analytics on healthcare in BC, you often need access to data from multiple data holdings across multiple organizations. That's where the Health Data Platform BC comes in. HDP BC was developed by the Ministry of Health in partnership with the Provincial Health Services Authority, the Regional Health Authorities, the BC Support Unit, a unit of Health Research BC, Population Data BC, and other public sector organizations with matching funding from the Canadian Institute for Health Research. HDP BC makes data from BC Health Partners safely accessible in one place for authorized research projects. Data available through HDP BC is always de-identified to protect privacy. This means identifiers such as names and personal health numbers are removed. HDP BC's approach to protecting privacy is guided by provincial legislation, the Freedom of Information and Protection of Privacy Act, an overarching privacy impact assessment, and a privacy and security framework based on the internationally recognized 5 SAFEs model. Here's a team of researchers and analysts that has a bunch of questions. They need lots of health data to answer their questions. HDP BC can help. They only need to submit a single application. It is reviewed on criteria developed using the 5 SAFEs framework. HDP BC facilitates the data access approvals working with the organizations that manage the data. In addition to the data available via HDP BC, requesters can also bring their own data. The HDP BC virtual desktop also includes industry standard analysis tools like SQL, RStudio, Python, and by request, SAS, and tools that let you collaborate, share, and learn from other projects like GitLab. Because the application process is streamlined and all the tools and data are available as soon as a project is approved, the team can start work quickly. Working on the HDP BC virtual desktop is the same as working on any PC without internet. Data in and out of the HDP BC desktop is controlled, and researchers are provided access to de-identified data. The analysts and researchers can use the metadata service to look for the column names they need to build queries. GitLab contains code samples, tutorials, information on data quality issues, and more. It's also a place where teams can share what they have learned with other project teams. Data analysis can be done with tools that the analyst is comfortable with, in SQL, RStudio, or Python. Code and results can be saved in either a user's secure project folder or the shared project space. Results can be simple data tables or formatted into publication-ready visualizations. To remove results and project materials from the platform, projects must request an output review. This is completed by a human not involved in the project to ensure appropriateness of release. If you are considering HDP BC for your project, you can learn more about it on our website. You can also contact our team directly via email if you have more questions.
All right. Hopefully that was a quick 4-minute recap and summarized everything that I walked you guys through. That was it that I had today. Let's give it